This is NNI Bites, Big Learnings, a podcast where fellow healthcare professionals converse about the latest in nutrition science. We are joined by the chairs and speakers of NNI and WNSC Workshop 103 as they share practical insights on early life nutrition and its impact on children's long-term well-being.
Hello and welcome to Nestlé Nutrition Institute's special podcast, NNI Bites, Big Learnings. I'm Yvan Vandenplas, your host for today, and I'm delighted to welcome Professor Raanan Shamir, Director of the Institute for Gastroenterology, Nutrition and Liver Diseases at Schneider's Children's Medical Center and Professor at the Faculty of Medicine, Tel Aviv University. Professor Shamir is a leading authority on pediatric nutrition and growth with extensive contributions to research on complementary feeding and its impact on lifelong health.
Thank you, Yvan, for your kind introduction. It's a pleasure to be part of NNI Bites and to discuss how complementary feeding is essential to a child's nutritional journey and health outcomes.
So I have a few questions for you. First one is, how do you define complementary feeding? And why is it critical in early life, not just to meet the growing nutritional needs of the infant, but also for oral, motor, and sensory development?
So, complementary feeding is a process. It starts when breast milk alone is longer sufficient to meet the nutritional requirements of infants. And at that time, other foods and liquids are needed alongside with breast milk. It also follows the motor and sensory development of the infant, and it is critical because it shapes the feeding practices later on in life. And it has some health benefits that we can discuss later on.
So, what does current evidence tell us about complementary feeding practices worldwide? Are families introducing solid foods at the right time? And what are the implications of delayed or too early introduction of complementary food?
Well, first of all, when we're talking about the right time and whether parents are following that, we need to define the time. And we're talking about most societies are suggesting a window of between 4 to 6 months of age. The WHO recommends 6 months of age. But in studies from Europe, from USA, and also other parts of the world, it has been shown that parents expose their children to complementary feeding before 4 months of age, usually too early. And by the way, interestingly enough, in all studies, they demonstrate that formula-fed infants are exposed to complementary feedings before 4 months of age more than breastfed infants. That's one. We know that there is a significant amount of parents that are exposing their children to complementary feeding before 4 months of age. And this has deleterious effects. We'll discuss it later, I assume. And also too late, after 6 months, is also a problem because then there is an inadequacy of the nutrition that the children are provided with.
So, according to your opinion, what would be the best age? Because there is always debate on whether introducing complementary foods relatively early, let's say at 4 months, offer nutritional benefits. So what does the evidence tell us?
So the evidence tells us that if we introduce complementary feeding before the age of 4 months, then there are risks for later on non-communicable diseases in later childhood and also in adulthood. Also, if we introduce after 6 months of age, it's not only the nutritional inadequacy, but also the development of feeding practices. We did not discuss it, but it's not only the time. When we introduce children with complementary feeding, there are cues, motor cues, that are telling us that the child can be introduced to complementary feeding. And then if the parents are not tuned to those cues, then the child may suffer from inability to be introduced with complementary feeding. By the way, another issue is that some of our systems are ready at the age of 4 months and are not ready if we are introducing it too early.
Thank you. So, does complementary feeding also have influential aspects beyond nutrition, such as microbiome development, allergy prevention, risk for overweight?
Thank you. It's a good question. If we talk about microbiome, this is a issue that can be a podcast by itself. What do we mean by a healthy microbiome? But we know that when we introduce complementary feeding at the right time, the composition of our microbiome is with less pathogenic bacteria and more with what we call good bacteria. Talking about health outcomes, we know that if we introduce complementary feeding before 4 months, for example, it increases the risk of food allergy. And also if we delay it beyond 6 months, then it would also be associated with increased food allergy. We know that it's not only for eggs, for example, and peanuts, that if we expose them between 4 to 6 months of age, you decrease the chance of having food allergy. If we discuss diversity later on, it also have an effect because the more foods that you introduce, the less food allergy you have. And regarding obesity, there are studies showing that introduction of complementary feeding before the age of 4 months is associated with increased risk of obesity.
So, formula-fed infants often develop cow's milk allergy before the age of 4 months. Should the introduction of complementary feeding in infants with or without cow's milk allergy be the same, or should it be different?
Well, I tried to shy away from cow's milk, as you noticed. It's a difficult issue because with cow's milk, there is another component that we need to address. First, we know from many cohorts that if you delay after the age of 6 months, there is an increased risk of having cow's milk allergy. When we're talking about early introduction, the problem usually, and we're talking now about formula-fed infants, that if we do not introduce cow's milk at all until the age of 4 to 6 months, and then we introduce them, we don't see a benefit, but we don't see a harm. However, if we introduce them, for example, children are born, are putting in the nursery, and the nurses are giving them a bottle of milk, or the parents gave formula that contains cow's milk and stopped giving the formula and go to exclusive breastfeeding, we know that the discontinuation, there is accumulating evidence that it increases the risk of cow's milk allergy. So if the child is exclusively breastfed, you can introduce cow's milk between 4 to 6 months of age. However, if for any reason you introduced formula, then it should continue to be given without interruption in small amounts, because if you give it and stop, it increases the risk of cow's milk allergy.
Thank you. You already touched it briefly, but can you throw some light on the recent WHO guidelines on complementary feeding?
Sure. Well, the WHO guidelines suggest two things that are not in accordance with what we discussed early on. They do not recommend the window of 4 to 6 months. They should say that complementary feeding should be introduced at 6 months of age. They are also suggesting giving cow's milk rather than formula. And those recommendations are based on low-income countries, where if you introduce early on, you increase the risk of infection because the hygiene in those areas is not optimal. And also, when they are exposed or given complementary feeding before 6 months of age, the food items are many times not nutritious, and you increase the risk of malnutrition and micronutrient deficiency. However, when we're talking about high-income countries, then the issue of hygiene and the exposure to non-nutritious food items is less relevant. So in those countries where you want also to decrease the rate of obesity and food allergy, I think that 4 to 6 months would be a better choice. The other issue is regarding the exposure to cow's milk. That one of the things that we know is that it is important that we will provide children with food that is rich in iron, and cow's milk is poor in iron. Also, there are reports of cow's milk being given to children and increased occult blood loss. So this would not be good for children with iron deficiency or even without iron deficiency. So my recommendation would be not to give cow's milk, pure cow's milk, before the age of 1 year. So I beg to differ a bit.
Okay, thank you. So from a practical standpoint, what does healthy complementary feeding look like in today's world, and is it the same in all parts of the world?
Well, I don't know if it is the same in all parts of the world, but we should aim at it. We should aim at a large diversity of all nutrient-dense home-cooked foods or commercially frozen meals, something that is not available in other parts of the world. And it should be based on whole ingredients without added salt or sugar. We also should predominantly provide children with plant-based foods such as fruits, vegetables, legumes, grains, fermented foods such as yogurt. And the complementary foods should be rich in fiber, iron, zinc, omega-3, and low, as I said before, in sugar and salt. And also in ultra-processed products. Hygienically safe goes without saying, properly prepared, and it should include the early introduction of family-adjusted and country-specific food allergens.
Thank you. So, Professor Shamir, thank you for your insights. Before we end, what's the one message you'd like to leave with our listeners?
One message is that listen to your child. Listen not for music, but for his developmental cues. It's not rocket science. Use your instincts. And if you are in high-income countries, expose your children between 4 to 6 months to all allergenic foods and repeated exposures, and not giving an allergen and stopping is also important.
So thank you again, Professor Shamir, for joining us on NNI Bites Big Learnings. And thank you to our audience for tuning in. Stay with us for more episodes where science, nutrition, and innovation come together to shape healthier futures starting from early life.
And that concludes today's episode. Thank you for joining us for this special episode from NNI and WNSC Workshop 103. We hope you enjoyed and learned from this quick discussion, fellow experts. Till the next episode.